Good afternoon. Thank you for being here. My name is Michele Stevens, and I'm the Public Health Director for Health and Human Services. With me is Dr. Teresa Frankovich, our County Health Officer, and Sheriff William Honsal. Let's get started.
Hello. Today, as the Health Officer of Humboldt County, I am issuing an executive order for the County of Humboldt to shelter in place. I want to emphasize to people that I understand that this has been an incredibly difficult and stressful time. The pace of change in this event has been staggering, and I feel like people no sooner get up and understand the day's plan than things or recommendations change over the course of the day. All I can tell you is that that kind of response and evolving situation, it requires a rapid change in approach. So I think this moment really emphasizes pretty clearly that public health is more than just a building or a department. Public health is all of us, because we're all being asked to respond to this event. I want to reassure people that this announcement is not because there is a significant change in our own community. We still have our single previously identified case of COVID that has long come out of isolation. We have conducted approximately 87 tests today between the private sector and the public health lab. There are about 15 of those that were pending as of this morning, and we have an additional number of specimens being tested today. Testing will increase over time, and accessibility will increase in time overall. I'm issuing this order right now because of the changes that are happening across the country and across the state. What we are seeing is an increasing need to increase our social distancing, okay? So we've been talking all the way along about the need to use distancing measures to address this, and it began right with saying, don't gather in big groups. It's helpful to keep those groups smaller. Then it progressed to saying we really need to get rid of these mass events, and I think people who are adjusting to that. Schools have been involved in this process as well, and I think now we are at the point on the continuum where the circumstances require that we use one of the bigger tools in our toolbox, which is using the shelter-in-place order. The idea is to maximize the distance between people as much as possible in order that we can minimize the impact of additional cases coming quickly into our area and impacting our healthcare system. So I think the overall situation nationally and in California is telling us that in the areas that have had this occur and are escalating at this point in terms of number of cases, we're getting lessons learned from those areas about what interventions are helpful, and that is beneficial to us to learn from those. One of the things that's suggested is that we know, even though we have no documented transmission at this time in our community, we also know that many of the areas that have had issues now with increasing cases did not have knowledge of community transmission before it was occurring, right? So what we know is that there's likely to be, in communities, low-level transmission occurring before it gets on the radar. This move today for us allows us to be proactive about trying to limit any additional spread if there is COVID existing in our community, and also to slow it when it arrives on our doorstep if it is not yet here. I can't emphasize enough to people how critically important that is as we watch, for instance, the Bay Area and the case increases. We need to protect both our most vulnerable population in terms of seniors, those with chronic conditions, and we also need to protect our healthcare system. We will all do much better through all of this if the healthcare system basically needs to care for people in a way, in a time frame that allows them to handle everything appropriately. What we want to avoid is a large number of people, for instance, requiring hospitalization, if we can prevent that. So we want to make this transition smoother from having no cases identified to having an increasing number of cases identified. So when we are issuing this order, it will be put online. I have signed the order, so people can look at the details of the order and understand what it means. I do want to note that shelter in place, I think, sounds difficult to people, and it is, but I do want to reassure people that essential services will continue. People will still be able to get their groceries. They will be able to go to the bank. They will be able to mail packages. They will be able to go on their medical appointments. That is all possible with this in place. But what it does say is that we are no longer having groups of people gather who are not in a family unit living in a household. That's an important way to keep people who don't normally come in contact together from different realms to assemble and be able to transmit infection. I want to remind people that although the way we function locally, our normal day-to-day activities are going to look differently over the coming weeks, we will get back to where we were. We will get through this, but it's going to take community collaboration to do that. It's going to take people cooperating with the process so that we really have, again, this ability to make sure that when COVID is circulating in our community, we are all managing it well, including our healthcare system. Sheriff, if you have any comments?
Thank you, Dr. Frankovich. I think it's really, really important to stress that now is our time. We've seen this occurring around the world, and we've seen it in our country, we've seen it in our state. Now it's time here in Humboldt County to act. Now, we've been known over the years to be resilient, to be independent. Now we need to be known for coming together as a community. And that needs to happen now. We need to care for others by listening to what is being said today. We do not take this lightly. This order is going to affect everyone in the county. And to shelter in place is something that we know demands a lot on our citizens. But this is what's best for everyone at this time. And we have to take this serious. There are many people that maybe aren't taking as much help up here as we need at this time. And so I'm just asking for everyone to remain calm as much as we can, come together as a community, but also look out for others. If you have elders in your family, please check in with them. I think people should be calling and making sure that others are taken care of. If you are able-bodied doing shopping for an elder, please do so we do not jeopardize our eldest population from going out and experiencing, possibly getting infected by this. I think it's also important, a part of this order is also stressing the fact that we want to partner with businesses here in our community to establish a time when our vulnerable population and our senior population can go shopping by themselves. I know a lot of businesses have done that already, but I think it's important as a part of this order to establish guidelines that suggest that that happens. This is not a mandate for that purpose, but just a suggestion that that happens to make sure that we can have our seniors go out and do their essential shopping, and not and be infected or pushed by others around them. So again, information is fluid. We'll be having more briefings as things go on, but we will also be respectful of our community guidelines as well as our shelter in place. And so a lot of the information will be shared online through a video conference and those kind of things.
As the sheriff mentioned, this is a time for preparedness, not panic. And we can absolutely make a difference on how this unfolds in our community by how we stand together and protect those most vulnerable. So I appreciate everyone's efforts.
If anyone has any questions.
I have some questions on behalf of our Southern Humboldt media partners who are not able to be here today. First, from KMUD, they'd like to know what are the homeless individuals in our community? What is the mandate for them? What should they be doing in this time?
Well, and I think when you're able to review the order, it does note in there that obviously what would be desirable is to have homeless find shelter. And what I can tell you at this time is we're working really hard with our partners to try and help that happen.
On behalf of Kim Kemp, I have two questions. What are your recommendations? How does this impact the cannabis industry, our farmers and other involved in that industry?
So when you, again, are able to look at the order itself, you'll see that businesses such as agriculture are certainly allowed to continue under this order, and that protects all kinds of agriculture. The other thing is that there is a provision in this that speaks to essential services, including things that address quality of life while we're in this shelter period. And so I think it really is dependent on businesses being able to adapt their model so that they can serve people, for instance, curbside, that type of thing, rather than people shopping in congregate.
And finally, from Kim Kemp, she wants to know more information regarding enforcement. How is the shelter in place going to be enforced?
That's a good question. Right now, the public health guidance and authority comes from a health and safety code. And so it is backed up by the health and safety code. The violation of such ordinance is a misdemeanor in the state of California. So I want to stress as far as law enforcement is concerned. So we are about educating and not enforcement of this. We want people to abide by this. So there's going to be a lot of education that goes on. We may be getting phone calls about congregating or businesses not being abiding by this. So our goal is to achieve compliance through education first. We are always going to explore that first, and then and ask for voluntary compliance. The last thing we want to do is cite someone or arrest someone for violating this. We want people to adhere, respect this direction that this county is going, and so we hope that we can achieve that voluntary compliance.
And to piggyback off of that question, are those same laws going to be enforced in Hoopar and reservations?
That's another good question. So, as we know, civil and regulatory don't apply on Public Law 280, type situations. So, we would like the tribes to adopt similar ordinances so they can be enforced by tribal police.
What recommendations would you have for people that want to go outside, visiting parks, being out in nature?
Sure, that's also a great question. We really want to encourage people to be outside, and fortunately, we live in a place where that's easy to do. So the same rules apply for outdoor activities, which are, the whole point of this is social distance. So we want people to be active, but be apart. So again, those 6-foot distances are definitely important, and in general, activities like biking and walking and running, those types of things are all fine. We're just not doing them in group settings. I also think it's important, and what's noted in this order, is that we do want to avoid, for instance, children, even not together, but utilizing, for instance, the same playground equipment. Those spaces that have communal sort of property. So while we want everyone to be out and about, we do want to sort of close off those spaces so that that is not accessed.
And one thing, we're told supplies at the blood bank may be low.
Mhm.
People wanted to donate blood. Do you have any?
I would say that although it's not specifically listed in this order, we will make clear in the FAQ that blood donation is considered an essential service.
I think it's important to note too that this is not a curfew. A curfew is not a part of this. And so we are not shutting everything down at 10 o'clock at night, for example. This is a shelter-in-place order unless you're meeting one of those essential guidelines, essential activity, essential business, essential travel, as outlined in this.
Is there a timeline for this, and is the declaration going to need to be renewed at any point?
Well, it goes into effect at midnight tonight. The current plan is that this would expire, I think, April 9th, I think is what we have on there. I just want to be sure. But obviously, it's possible it may need to be reissued depending on the circumstances we find ourselves.
And I know you said people can still go to medical appointments.
Mhm.
A lot of doctors are canceling. Are
Mhm.
some appointments considered more essential than others?
Absolutely. So, we do want to emphasize that while people need to get their essential medical care, you're absolutely correct that there are some offices that are, for instance, delaying a well checkup, something like that where we can avoid bringing someone into the environment where others are sick. That helps us avoid spread, and it also opens up capacity for the healthcare system as well to respond to individuals who are ill. So some of those more optional or not as time-sensitive appointments are being rescheduled, and I think that makes perfect sense.
And I know you said before that you guys aren't releasing how many people are currently being monitored. Can you speak to why that is, or give a ballpark number just for people who, I guess, may be concerned about that?
Sure. Well, again, part of the thing for not releasing numbers is it's something that's in flux all of the time. And basically at this point, monitoring of individuals happens for a couple reasons. People who are returning travelers in general have been instructed that they need to self-isolate for 14 days. I think that message has been loud and clear throughout, and people understand the need to do that. If we have a case, we are actively monitoring. If we have contacts of a case, then we would also be actively monitoring those. But again, that's dependent on cases emerging in our community.
And have you guys, I know we've been receiving reports from the public of, I guess, people testing positive or possibly having it. Can you kind of speak to, I guess, where people can get the most accurate information and if that is true or not?
Sure. So we will be updating the website daily with any positives. Obviously, we would put that information out. I think there are lots of rumors, and I think maybe some people get confused with the difference between perhaps being tested versus being a case, and may not be making that distinction. But I would tell people that COVID-19 is a reportable disease, which means providers, the reporting systems through laboratories, all have to report to public health. So we will be aware of those individuals. Welcome.
Hello. So I'm doing a Facebook Live with North Coast News right now. There's a lot of questions about what is an essential service. laundry mats. Can people go do their laundry?
Yes.
Can you explain? Can you be more generic?
Sure. And you know what I'm thinking is maybe it would be helpful for me to just mention a few things to give people a general idea. And of course, it will be available for everyone to look at as well. And again, there'll be an FAQ out there for people to access who don't necessarily want to wade through the entire document. So for example, newspapers, television, radio would be considered essential services, gas stations, hardware availability, plumbers, electricians, those individuals and businesses, educational institutions. So this is not a mandate for school to have no personnel on site by any means. We understand the need to still be able to deliver educational services in some format to children as well as food services. So the recommendations for schools, for instance, are not to have no one in the building, but to practice the social distancing that we have been talking about all along. Additional items, restaurants and other facilities, we want to make food easily accessible. So again, grocery stores, farmers markets, those types of things are considered essential services in here. Again, with mandates about how we try and distance from each other. There are, the schools of course can provide their program, businesses that supply products for people who need to work from home, legal, accounting services. There's a whole variety listed here. So many of the things that people do in their day-to-day life will still be doable, but we need to think about doing them in a different way in terms of it's not, going out in a group, not browsing for clothes, that type of thing.
So are you recommending restaurants fully close, or they can still stay open and you can take that?
Absolutely, and that does not change for what was actually announced by the governor in the sense that, yes, they are to shift to that sort of delivery takeout model rather than dine in.
Thank you. And then what about flights coming in and out of Humboldt? I don't know if you're able to answer that. So can people still come into Humboldt County? Is that still available?
Well, and of course, the airport operations are considered essential, certainly in this. Obviously, we are discouraging travel for people in general, and essential travel obviously can still occur. And again, airport operations are essential.
And then is there going to be a curfew? Sorry. Is there going to be a curfew?
I think as the sheriff mentioned, there is no curfew with this.
And then you kind of went into how will law enforcement be enforcing. And then with other areas going along the course, Northern California, that have shelter-in-place orders, have they been experiencing higher volumes in crime? And if so, are you ready to deal with that in Humboldt County?
I have not heard of at least in our neighboring counties, of crime that escalated as a part of these orders that have gone through. So, but we are prepared. We are a public safety agency. We have appropriate staffing that's available and on duty at any given time. And we are making preparations to make sure that we are in this for the long haul.
Thank you. And then for the community who doesn't obey, who are going out, let's say they want to go to the park and be out and about, how will you approach that situation?
So the situation is, again, we want voluntary compliance. We're not, there are activities that people can go to. They can go to a park and recreate by themselves, as long as they keep their social distances. We, like Dr. Frankovich said, we don't want them using communal equipment, those kind of things. That's why gyms are going to be closed and these playgrounds are going to be closed. But at this point in time, we understand the mental health of our community is vital. But keeping people indoors is not healthy. As far as that goes. So people, could go and walk on the beach by themselves with their family is a good time to do that, to hike a trail and that kind of stuff. We just don't want people congregating together, just out wandering for no purpose or another. So that's our goal. And so for the people that are violating and openly violating that that congregating and social distancing and not obeying the guidelines of this order, we will remind them that they are in violation of the law. It is a misdemeanor, and again, try to get them to voluntarily comply with the law. And we all have records keeping systems, and we know who has been warned on this, so that second or third offense could meet with a citation or arrest.
Thank you so much. And then last question, you mentioned this earlier, essential businesses. So families are still able to go to school to get lunch right now, because I know schools are providing lunch for kids.
Exactly.
Which is an essential service.
Right, and again, we're just asking that even for those businesses that remain open, that are essential services, that they really just implement all of those social distancing tools that we've talked about so that it's safer for everyone.
Great, thank you so much.
Welcome.
So you did just mention mental health, and obviously this is a very stressful and anxiety-inducing time for people. Is the Department of Health, are you guys going to be sharing resources, or DHHS, just to kind of help people during this time?
Yes, we're actually currently having conversations about how we might set up a mental health line for folks within Health and Human Services for people to access support. It's a highly stressful situation for everyone, and so we're definitely
Them that we are able to control this through this means right now, and so we don't want to stress anyone out. Thank you.
I do want to emphasize that making the move now, I think, does give us a big advantage in addressing COVID. And I have complete confidence that we will manage this. It's just, I'd like it to go as smoothly as possible for our community with good healthcare access throughout, and as few people becoming ill or seriously ill as possible. And I think, again, at this point, we have many options on our own to help that be what's happened. So, we really need to just adopt those behaviors that we've been talking about all along, the hand washing, the frequent sanitizer, the covering your cough, the staying home inside even more when you're ill, and distancing yourself within your home from other family members. All of those measures are still very important in addition to the social distancing we're talking about now. And I want people to understand that they are a big part of this response, because those tools are things everybody can do. And we're not powerless in this. We do have tools to use.
Two community questions for you. One is in regards to bars. What is the order in relation to bars? And if they do not comply, can the public health department shut them down? What steps are going to be taken?
So the order really just, I would say, mimics what the governor's recommendations have already been in terms of bars.
And then can you just reiterate that this is not a curfew?
This is not a curfew.
Yeah, and let me just echo that, Dr. Frankovich has asked the sheriffs and the chiefs of police to carry out this order. And so we will be, enforcing this order. And again, we don't want to be the necessarily bad guy in this situation. We want voluntary compliance. That's our goal. But we will do what's best for this community. If people are congregating in bars, we will be shutting down that bar, and we'll use every single method we can use to shut down that bar.
As far as some of the other things like rent moratoriums, who has jurisdiction over that, and is this also being included in that?
That is not part of this order, although I believe the governor has been putting out lots of information about that.
So you're not sure who, would it be cities or counties that would be addressing those types of things?
Honestly, again, since it's not addressed in this and it's ongoing guidance from the state, I think that's what we're looking to as well. Certainly, I'm sure there will be local discussions on the point.
Well, On some of the state calls, they've been saying the counties and the cities have jurisdiction more so than the state. So I guess who ultimately is going to be the one to
Right.
make these decisions?
And you're right, much of this is local decision-making, but I think we generally look to the state and federal government for guidance on these issues as well. And I don't know if anyone at the table has a better answer in terms of who is responsible right here for looking at this.
I missed what you said. You said in terms of rent? Is that what you're talking about?
Yeah, like moratoriums
Right.
on that and water and utility shutoffs, that kind of thing.
We would really be looking at the state of California there's legislation happening left and right daily around that. And so when we get the call from the state every day that we're on, or written guidance or directives, we're definitely looking at that and looking at who has jurisdiction to implement those. What's challenging, I think, at times is when there is a recommendation or guidance from the state, the enforcement piece can be a bit challenging and gray in terms of what part of a county jurisdiction should be enforcing that. So those are questions we put to the state often.
I have two more questions about homelessness. So yesterday in Governor Gavin Newsom's briefing, he mentioned that over 1,300 trailers were going to be installed across the state. And he says he's been meeting and talking with local cities, counties. Is that something that you guys are looking at here for Humboldt County?
Not particularly trailers. We're looking at securing hotel rooms available for homeless individuals to isolate and quarantine when they're waiting for their test results or if they're positive, because there is a 14-day quarantine when testing positive. So that's what we're currently looking at, is reaching out to different hotels and securing agreements in order to be able to do that. Looking at how we would transport someone from the hospital to a hotel room safely for our staff. Hand washing stations throughout the county for homeless individuals, because that's one of the two top things that are the guidance, right, is stay home and wash your hands. And those are two really challenging things for people who don't have access to that. So those are the types of conversations we're having with cities and other homeless service providing agencies and our partners and the hospitals as well.
Well, you answered my question. Thank you.
Going to be a grace period before you start really enforcing the stay-at-home clause? Is there going to be a time frame where you actually start, like 2 days, 2 days a week? Is there something that you're looking at, or just kind of on the behavior of the people?
Yes, this goes into effect at midnight tonight, so we will start enforcing it at 12:30. As far as us going out and reminding people if bars are open and those kind of things, and restaurants are still serving food at that time, that we will be out there trying to educate people. That's the goal here. Is we'll push education. That's a part of our mandate. So we can use that enforcement arm, but we want people to come into voluntary compliance.
Again, it's a big sacrifice we're asking of people, and I'm doing it at this time because I think it will have the maximum impact. So delaying and allowing long grace periods would not be optimal for getting the effect we want.
Last question.
Have you guys started looking forward to if we get infected, if it gets here, when it gets here, what the next protocol will be? I mean, like, what are we looking at?
Sure. Well, obviously, at that point, a lot of the emphasis shifts to our healthcare system capacity. And so we're already doing a lot of planning around what we do if there are a large number of cases. Where can we accommodate those individuals? How can we best provide care? So that's part of our planning now, and obviously down the road will become a big focus of what we're working on.
Thank you all. Great questions.
Thank you.